Good morning and thank you. Hello. Good morning and thank you very much, Honorable Minister, for this opportunity. Good morning, um, ladies and gentlemen of the media. I'll just give you a brief of our current update as far as the COVID is concerned. I'll give you a summary of our epidemiological situation. What are some of the, how the distribution of our confirmed cases across the country, what the situation from the Kotoka season, and what precautions we need to take. And also, I'll do a brief touch on our preparation in response to the global situation instead of vaccine and any other issue that you crop up. As of the 19th of December, our total positives that have been recorded is 54,043 cases. So far, we've conducted 646,687 tests, which is about 20,812 per million tests population, with a cumulative positivity of 8.4%. As of the 19th of December, which is the current reportage that we have our data, we recorded 89 cases, and I'll give you a breakdown of that. We've so far discharged about 52,777 of cases, accounting for about 97.7%. We have recorded, unfortunately, 333 deaths. That brings our case fatality rate as the number of deaths per cases we've had to 0.62 compared to the global average of 2.5%. Currently, we have 933 active cases. This is the number of people in Ghana now who are currently carrying the virus. The majority of these active cases are in Greater Accra. About 60.9% of them are in Greater Accra, with 4% in Volta region. Eastern has 2.8%, Central 2.6%, and as you can see, Ashanti, which used to be the second, now is relatively low. So far, all 16, since the beginning of the pandemic, all 16 regions have reported cases. And we have also recorded cases in 243 districts, which means that about 17 or so. We keep telling you, because the number of tests done is not uniform every day, we depend on the moving average, 7-day moving averages. And you can see that okay, I'll go on. You can see that if you project, okay, that the significant, in the last few months, the number remains quite low after the peak in August, September. Yeah. If you also look at the number of cases, moving average, you can see that it still remains flat. And the most important thing was the fact that on the 7th of December, when we went for the election, our concern was that it may lead to additional a spike of cases. Fortunately, it looks like the measure that were put in has worked because we are not seeing any higher cases compared to what we recorded during what we were recording prior to the election. Okay. Back. Okay, so the next slide shows that if we were to put all these things together, over the number of weeks we've had, this has been the number of cumulative cases that we have recorded, whether it's routine, contact tracing, etc. But you can see that the numbers, as we look at this moving average, has also come down. You can have the same distribution by region. You can see that the middle of June, July, August, when we had a peak, almost all regions were reporting cases. But in the last few weeks, we are having mainly in Accra, and the numbers too have also come down. In summary, you can see this chart showing the total spatial distribution of cases across the country, the peaking in Greater Accra, Ashanti, Eastern, Western, and Central region, where we have the deeper colors, and mostly parts of the Northern region, Upper West, Northeast, and Savannah, showing relatively low number of cases reported. When it comes to the same active cases, you can see that Greater Accra, Deep Red has larger number of cases compared to the others. Currently, Ashanti has only 12 active cases. And Ahafo, Savannah, and Upper West have no active cases at all. As you can see, we keep telling them a significant number of the people are females, and the larger number are in the active ages of between 20 and I'll say 49 years. That is when we have the larger number of people contracting the disease. And so that tells us the way we should behave and how we should monitor our behavior. Of course, this is a very common graph that we can see. You can see that continue to widen, that as the number of active cases goes down, the number of recoveries also goes up. And so this is where we are. And we are happy that we're still having this situation on our ground. The next slide is just showing us daily active cases. And you can see we peaked somewhere in June, and since October we had down. In the early November, I remember we had a lot of spike, and since then it's been remained low since then. What has been the related deaths? Again, just as a reminder that the same, when we had a peak, that's when we had a large number of deaths. In the last few weeks, the number of deaths has also significantly come down. And of the cases of the deaths, majority distribution of the deaths, you can see that we have more males dying. And then if you look at the comorbidity, you can see that those people who are dying, most of them are comorbidities. It's only 24% that we cannot say they have some underlying condition. And that is what, just a reminder of all of us, to remind us that diabetes, hypertension are the key areas that actually will lead to as people succumbing to the death, to the virus. Currently, most of our cases in the last few weeks, since of September when we opened the airport, which obviously was an important step, that we knew we were going to get cases there. And so we've been monitoring specifically the cases that is coming in from the Kotoka International Airport. That's the kind of importation that is coming into the country. And it's for that reason that we have a two-stage test which shows that we are reducing the number of positives that are likely to come into the country. So far, we have tested about 103,720. We have recorded 556 positives from the airport as of 21st of December. We have isolated 384 of them, 69%. Currently, from the airport, we have 172 people who are in the country who are active cases, which means that they still have the virus. They are being managed, some in the facility, but a significant number are being monitored at home. We've not recorded any deaths so far, and of the number, we've done contact tracing for 355 of them. What is interesting is that about 250 of this total number I mentioned are Ghanaians, 306 are non-Ghanaians. And you can see that if you look at the daily distribution of cases, over the period, the numbers continue to go up, and it's a reflection of the positive cases in the countries that they are coming in from. Interestingly, you can see that the very first month, 1st of September, when we opened, we recorded 46 cases. In October, we had 98 cases. In November, 168. And in December, as of the 21st of December, we have recorded 244 cases. It shows that where they are coming from, the positivity is also reflecting in the country. But fortunately, the system is able to identify and isolate them and protect us. So these are the positivity. You can see that the positivity rate at the airport continues to go down. That shows that someone may ask, maybe the numbers are down because the total number of people coming in has increased, but it shows that the positivity rate is high, which means that the risk has gone up a bit. What is the country of departure? The largest number are coming from the US, followed by the UK, and then Nigeria. And the rest are low. So these are to show us that these are the potential hotspots of people that were coming in them. So what we are doing is intensifying our monitoring of those who come in. Even if you are negative, we continue following up and giving you a call to ensure that you are okay. If your condition changes, we are able to quickly isolate you. We will be continuing to tell everybody to be careful on those who come. Even when you are positive, we isolate you. When you go home, because you can isolate, please remain in isolation and don't interact with people. We also want people to know that those who have come in have a higher risk of being positive or turning positive, and so we need to be able to protect ourselves as we engage them. This is not to stigmatize them, but also create an environment for everybody to be aware of this risk and also protect themselves. Very soon, in the next 3 days, you are going to get into a different season, which is Christmas and, of course, 31st night celebration. These are all potential risks that we'll be careful of. Like I said the other time, the risk is that because there's going to be increased commercial activity. You can see traffic in Accra and other places. There's a lot of increase in travel across the country, and so there's going to be a lot of mixing, and that creates roads. We're going to have a lot of social activities, weddings, churches, and place of worship is going to be full. These are all areas that we need to work on, and just like we prepare for the election, we are also psyching people up about how to prepare ourselves for these events that are coming up. For places of worship, our advice is to ensure that the places of worship are well ventilated, and that we need to promote social distancing before, during, and after service. Meetings for both indoor and outdoors events must be ensured that we promote social distancing. Let's assure that we have availability of a health. I'm sure most churches have a response team that will be able to identify signs and symptoms and quickly isolate such people who may be potentially having the case, and of course refer them. They must continue to take contact details of all attendees, so should anybody turn positive later, we know who to go and look for and quickly offer the care that they are needed. And all the worships, churches, mosques, everywhere must ensure that they have hand washing facilities with soap and running water, hand sanitizer with at least 60 or 70% alcohol when soap and running water are not available. So the best option is hand washing, but if you don't have it, make sure that you use the hand sanitizer to look at. And let's all encourage all attendees to make good hand hygiene and washing hands with soap water for at least 20 seconds as they come in. So these are specific for probably in the washes area, but I'm sure there are other centers that present a similar opportunity, and people must also follow the same area. Let's make sure that we put signs of the protocols, display them everywhere so that people can see what to do. They are able to read and see this is what we need to be doing. Let's all encourage the use of masks for all congregants. Everybody must wear masks. Let's intensify cleaning and disinfection of surfaces. And the service times should be well spaced to allow for cleaning and disinfection. If you are having one or the second service, there should be enough time for you to be able to prepare the place for new people to come in. Let's take sure we will stop community sharing of worship materials as much as possible. I think Example, microphones, communion trays, offertory bags are all areas that are possible that people can be touching and moving from one place to place. We must make sure they are okay. Where possible, whether it's church, a virtual meeting will be encouraged. Whether it's a festival or something, where you can do it by virtual, let's encourage virtual so that we reduce the amount of engagement. When someone is here, as I said, let's identify and quickly refer. You know, during the festival, we're going to have a lot of people dining out and going to pubs, clubs, etc. Let's ensure that we display the no mask sign. But it's not just the display of the mask sign. You should be providing the information that you wear your mask properly. Don't create a situation where you don't wear your mask until you get to the place. When you wear it and you enter, then you take it off. You must wear a mask all the time. We must provide soap and running water in these areas to ensure that people are able to wash their hands thoroughly. Ensure we have a regular disinfection of surfaces, and all staff adhere to the safety and hygiene protocols and regular hand washing in the venues that this place will take place. Like I said before, for all events and social gatherings, let's encourage all invitees to wear masks at all times. Even the time just when you leave home, as we say. You may supply face masks as souvenirs at the entrances if you find people not having one. You must have enough hand washing facilities positioned as strategic areas where people can use it at the entrances, in the washrooms, etc., so that people can make sure they keep washing their hands. Let's observe strict social distancing again, and as much as possible, public address facilities shall be required to provide at least 2 or more microphones and carefully sanitize them each time it's used. That's another thing that can be moved from one place to place and can lead to spread. There are many things that we need to look out for. Some of our practice, we cannot mention all of them. I can just give an example of a wedding where after the wedding, the couple is made to stand there and everybody in the church coming to shake hands. Some of these things are very dangerous and we must desist from them. Finally, I just want to just share an update on our preparation for vaccine deployment. Currently, we have a technical team on vaccine readiness and deployment working. They are reviewing the target groups that will be needed vaccine. We are also reviewing a number of vaccine candidates, as was mentioned the other time. FDA will be responsible for certification and registration of any vaccine before the country can use it. If it requires having to do a local phase 3, we are dependent on FDA, provide safety for us. And currently, Ghana has applied for the COVAX facility, which provides about 20% of our needs from the Gavi Global Alliance for Vaccine Initiative that is coming to other countries. We've made an application and we are working towards and also getting additional one based on our needs to be able to deploy a vaccine when they are ready. Thank you very much. So let's keep safe and let's stay home when we can. Thank you very much.
Thank you very much, Dr. Patrick Ugabaji, for that update. And as Dr. Waji argued, we are entering the microphone is set up, so good time to take your questions. If you have questions, be they in English or any other language, we're happy to take it at this point in time. Yes, sir, please step forward. Please step forward. So I have 1, 2. Are there others? So first 3. So observe the necessary physical distancing while we take our questions. Is there a problem with my microphone? Is that a problem?
Okay. Good morning, Honorable. Pastor, am I in your official pastor? If you me free Kingdom FM. Now my question here two. First one, Dr. Abuaje. Dog me bacho me bacho you say you call election or money electoral commission in share kakra mode eto akwema like election course so. A man for raise the question say Ghana you started your Premier League a bobo supporters. At the end share money GFA4 a year to allow supporters back to the stadium. The second one is to come honorable. You only say president updates no mind back with the beaches no and a night club na pubs no. Earlier in still na you close these areas no. But you only say still na man for that so called the beaches and sports ni ye juma. You go festive season ya sanka se ye NBA. At the end, I'm making sure, say, mobile ensure to say these places still a close down pampa, say, amount for alcohol, amount for abuse in my area and so that's it.
Yeah, good morning, Honorable Minister. My first question goes to Honorable Minister for Information. Now my name is Nana Poku from Daily Searchlight. We are in winter. And we all know that in winter, because of the cold weather. No, overseas, please. I'm not talking about Ghana. I'm saying this because some 30 countries have placed embargo on British flight into their country. I don't know if you are aware, and some Netherlands. So because of winter, people may come in to Ghana for Christmas festivity. So are you thinking of reducing the flights into the country or doing something about it? Because certainly when they come from overseas, they may carry the disease and bring it to Ghana to heighten or to spike up the disease. My second question, some parents are saying that their wards have been in the house for a very long time. They were thinking that the president was going to announce something substantive for the reopening of schools and the schedule and things like that. They didn't hear about that. What is the plan for the government? Has cabinet decided to do something about it because people are anxious to get their wards back to school? Now, my third question, Dr. Abuaji, you did mention about the plan by Ghana Health Service and government to contact some manufacturers of that drug to consider with FDA and things like that. Have you come to any finality, or you are just in the discussion processes? Because people were saying that it is too early to buy into that vaccine because it has some sort of ripple effect on some individuals in some countries. Thank you very much.
Good morning. My name is Salom Babiji. I work at the Finder newspaper. For the record, did you say that we had tested 103,720 people at the airports? Yes, and based on that number, how much have we made from the tests? And with that money, where is it going? Who is getting access to that money?
We have to do with our revenue. We don't make money from the tests. The tests are administered by a private organization that has been contracted by the Ghana Airport Company Limited to administer this antigen test on behalf of the Airport Company Limited and on behalf of the public. And they charge for the service that we don't make money from it. I think it's quite clear. Yes, sir. Let me take this. There are some questions you have to do before we
Thank you. My name is Atamensa from Ghana News Agency. Chief, you said the technical team that has been set up is reviewing some target groups that Ghana Health Service will administer the vaccine to them. I want you to expatiate on the criteria for selecting a target group. What informed your decision, and what are some things that you considered in selecting those target groups? And if you can give us a timeline that Ghana possibly will start administering the vaccine. Thank you.
Thank you. Let me give some quick responses to some of the questions that are directed at government. And then I'll invite Dr. Abuaji. Do you need me to switch microphones? I should use the other one. Then let me request that we do the sanitizing of the podium, because now we are sharing a podium. So first about beaches and nightclubs, and the suggestion that some of them have still been operating and what we intend to do about it. I think, first of all, we should shift from this attitude of, if you don't police us, we'll do the wrong thing. All of us have a responsibility to protect ourselves and to protect one another in these times. And the attitude that if you don't police us, we'll do the wrong thing, so what are you doing to police us, is something that we all need to gradually shift from. We have a personal responsibility to ensure that if we have been advised by the health experts that these are high-risk areas, protocols for protection have not been adequately provided for in these places, therefore they remain closed, do not attend to them, you owe it to yourself not to patronize these places as a first step. Persons who operate such places have a responsibility to ensure that once this is the advice we've been given, we comply. The third level of compliance would have to come from the security agencies. There's an executive instrument that guides all of these restrictions under what we call the Imposition of Restrictions Act. It is being renewed, I do understand, I think today is Tuesday, so today it is being renewed because the last one is expired. So it is law, and once it is law, we expect the security agencies to work and enforce this particular piece of legislation. But the first layer of responsibility is on you and I, that if these places are proscribed, we do not patronize them. If you have such facilities, you do not operate them. And thirdly, the security agencies seized with this piece of legislation are expected to act accordingly. There's a second question about whether or not we are considering reducing flights from these high-risk countries. As we always say on COVID matters, all cards remain on the table. The situation is reviewed every now and then, and depending on what the data suggests, decisions are made. So all cards remain on the table. That's a first step. But you must also understand that various countries have various methods or strategies in dealing with it. And that's why you see yes, it's a pandemic, but you see its impact on countries play out in different ways. In Ghana, some of the strategies implemented under the leadership of the president are the reasons for which, despite it being a pandemic and us recording over 52,000 cumulative cases, you see the impact managed in a particular way. Now, you would notice, therefore, that when it comes to travel, there are countries that don't put the layers of prevention that we have put in place. And so what they have said simplicity, close the airport or stop flights coming from this place or that place. In Ghana, we have a two-tier system. First, we're getting feedback from the microphones, please, if you can tune it down a bit. So in Ghana, we have a two-tier system. First is that before you are allowed to enplane to Ghana, you must have tested negative for COVID-19, not just negative through any other method, but negative through PCR. And you cannot enplane unless you demonstrate a negative PCR that is not more than 72 hours old. Doc, am I correct? Yeah. That's the first layer. Many countries are not doing that. So their answer is close the airport, don't come. We have that one. We say that in addition to that, when you arrive in the Republic, you will then have to go through an antigen test, which will give us results within 15 and between 15 to 30 minutes. We will know your results. It is only when you've tested negative that second time that you'll be allowed into the general population. If not, you will be advised and handled accordingly. What that means is that we have two layers of prevention that will arrest any potential influx of carriers. And consequently, we don't have to
as a first step, resort to some of these airport or border closure measures that some countries are resorting to. I hope I've answered your question well. So all cards remain on the table, but Ghana has 2 layers of prevention for international travel, but we continue to observe. And if need be and some changes need to take place, we would do so accordingly. That is why, despite the fact that we see commentary on platforms that close flights from UK, close flights from the US, we are guided by the layers of prevention that we have rolled out, but we continue to monitor the situation. School reopening. Cabinet will be meeting on the 30th of December. The President's task force on COVID-19 is actually going to be working throughout the Christmas period towards the New Year. One of the major items on the table is school reopening in the New Year. The President is receiving the briefs, the learnings from the limited reopenings that we did. You recall we did some limited reopenings for final year students to write examinations, for continuing students, I think in tertiary, etc. There are reports on how it has panned out, how they managed to contain situations that came up, etc. So the President continues to receive those briefs and those analyses, and the task force has a subcommittee working on school reopening. My understanding is that by the 30th, His Excellency the President, working with his cabinet, would have arrived at a final decision on the question of school reopening, and we'll have an opportunity to announce same to the Republic of Ghana, depending on where that decision goes on the 30th. So that's just a quick update on that one. We know that parents are anxious, rightly so. Many of you are parents. We are all parents. Even the volumes of food that the kids are eating at home is a matter on its own. But schools have to be opened in a responsible and careful manner so that they don't become places of cross-infection for our kids. But the President is just about to take a decision, a final decision on school reopening. He continues to gather both the reports and then the scenarios. And I think by the 30th, when Cabinet is done, a firm decision would have been made. On vaccines, I know Doc will give the full answer, but the President's instruction on vaccines is what I'm going to repeat to you, and I think he mentioned it during his address on Sunday. He wants to ensure that, 1, it is efficient or effective, and 2, most importantly, it is safe. And so if you notice in his address, he says that various stakeholders from relevant institutions have been put together to come out with a roadmap and do the various, scenarios and examination, so that by the time we opt to administer vaccines in Ghana, we are sure that those 2 parameters he has laid down, effectiveness and safety, are assured. That is from the government side. The science side, I'm sure the doctors will deal with it. Doc, I'll let you come and respond, but please let them sanitize the podium since we are now sharing a podium. Madam, please come this way.
Thank you, Honorable Minister. I think you touched on most of them. I'll start with the sports and the GFA. We've been engaging the GFA for a couple of months, and not just for football, but for other sports. And that's how some non-contact stops were asked to start. For the GFA, with the commencement of the league, we are doing very routine tests for them. We are, I'm sure you are aware of the situation where some players were not allowed to play because they were tested, and then we follow them up and make sure that those who need to be isolated are isolated. And so we do that even for Black Stars, etc. So there are stringent measures on testing to ensure that we don't create a platform for spreading of the. Currently, the spectators are still not allowed to be at the sports stadium, but as we continue looking at the science, we'll continue taking it. So we are actually working with GFA all the time. We have specific people assigned to support them. Wherever they go to, we are able to support them. And so that is what we are happening. The Minister talked about the school reopening, and I think it's in order. The vaccine, like I mentioned, is all about the safety and effectiveness. And so that's why we said that is the responsibility of the Food and Drugs Authority, who have the equipment, the systems, and the system to ensure that whatever they register meets the full standard of safety and the quality we will do. Of course, there are other committees that we are assisting them to do that. Now, the committee working on the criteria is still working, and when they finish, we'll share with you. But of course, some of the key criteria will be who are at most at risk. What are we going to do to the people who are more likely to die because they have comorbidity? Who are the people who are most exposed to the virus? And these are the one that is going to be the criteria in selecting the routine in which, once it's finished, it will be put out there for all of us to know. I think the rest has been answered already, so thank you very much.
Is there a second batch of questions? Is there a second batch of questions? Okay. Doc, we'd like to thank you and your team for being with us this morning. Colleagues, we'd like to thank you for being with us this morning. Wish you all the best.
Thank you very much, Honorable Minister.